and the very latest COVID wave on the coast. Could it finally, we could only hope, be easing up? Hi, thanks for joining me. I'm Dave Elliott, and we're going to start with that. Joining us to talk about it, Singing River Health System Chief Medical Officer, Dr. Randy Roth. Dr. Roth, good to see you, and thanks for being with us this morning. I always like to start with you by getting a status report of hospitalizations and how the Singing River Health System is doing right now. When you look at your 3 campuses, what can you tell us?
Our inpatient numbers are coming down. We're about 97, 98 today, about 17 on the ventilator, 17 in the ICU, I should say, about 10 on the vent across our 3 campuses. So our inpatient numbers are slowly coming down. I think we peaked at about 112 or 113 about 10 days ago. So we are seeing a decrease. We've had a couple of mortalities on some folks with COVID in the last week or two, but they were expected. Of those in our ICU, 75% are unvaccinated. So again, it's not bulletproof, but the vaccine has been very much proven to decrease hospitalization and mortality. So that's kind of where we are from the inpatient number. Other thing I'll mention is our testing sites are much lower. We're testing about 1,000 a day, and it dropped to about 300. We used to test in our 2 or 3 testing centers. Believe it or not, we'd have a 40% positivity rate back 2-3 weeks ago. That dropped to about 28 to 30% before we closed those down and we moved it to our clinic. So we are seeing, keep our fingers crossed, a decrease in our number of positives in our inpatients.
Yeah, well, let's expand on that just a little bit. Nobody knows. Nobody can predict. It's a forecast. And that's from Dr. Fauci right on down to Dr. Dobbs and every other scientist, doctor, and health expert in the world. But do you think, I know you hope, that maybe Omicron might be running its course, that we may indeed start to see the numbers continue to wane a bit?
I think, based on what we're seeing, yes, I think the numbers are going to decrease. As we're seeing the numbers decrease, we are seeing our vaccination rates slowly go up in the state and on our staff too. So hopefully the combination of decreasing positive cases and increasing our vaccination percentage will get Omicron behind us. But, what could be behind that? We don't know.
And now, you made a quick reference, and we talk about it all the time, about staff shortages being an issue, again, across the country, but also right here in our own backyard on the coast. How is that impacting Singing River Health System's ability to care with this pandemic continuing? Do you feel pretty good about things?
I wouldn't say I feel good about it. We're doing great things with the people that we have. People ask me all the time, how many beds do you have open? I have a lot of beds open. I don't have staff to take care of those patients in those beds, whether it's nurses, LPNs, environmental service people, respiratory therapists. We've had several hundreds of our employees go out with Omicron or with Corona in general. So it's not very good right now. I will say this. The level of care you're going to get is going to be excellent. It's just going to be maybe delayed. I'm just trying to set the expectation with our patients. In the old days, if you were sick in the doctor's office, you could directly admit a patient right to the floor in the hospital, and my hospitalists would take great care of them. Now they're in the emergency room sometimes for 2 or 3 days waiting for beds to be cleared upstairs in our hospital. So that is a new norm. Do I think it's going to get well? But we've pushed hard with our legislation to reward our nurses if they stay in Mississippi. That did not come through, but our CEO did a good job of trying to keep nurses local. So it's not great, Dave, to be honest with you, but we are ahead or doing as good as anybody else in the state. And it's not just a South Mississippi thing or a South thing. It's across our entire country. Every hospital that I know of is down nurses and working hard to staff more beds.
And we've talked in the past when Delta was just wildfire, and now with Omicron out there, the impact, and actually there was a point where the governor and governors across the country had to put elective procedures on hold as a result of that. Are you anywhere near that point?
No, we're not. I think it's a very good idea conceptually, but I don't think a lot of people that are not clinical realize that just because you shut down an elective surgery, you can't take that nurse that does post-op care and put that nurse in the ER or that nurse in the ICU anymore. There's a whole different skill set with our electronic medical record and everything else we do. So no, we're not doing that. No, we have asked our surgeons to delay some cases. We've limited the number of our ICU cases. Like we used to do 3 or 4 bypasses a day. We're trying to limit that to 1 and take our most critical patients first. Our 2 CT surgeons are working with us with that. But no, we're not shutting down electives. We are looking at them and making sure that we can staff them and take care of them.
I want to talk about something with you because I don't think the country is talking about this enough, and I want to get your view on it. One lesson I think we've learned in the last couple of years that generally speaking, America is an unhealthy country, and Mississippi is basically a pretty unhealthy state. What do you see in terms of hospitalizations and fatal outcomes relative to comorbidities, obesity, hypertension, heart disease, diabetes?
Well, you know, the first two ways that we've seen the biggest common risk factor for mortality was morbid obesity, or a body mass index of more than 35. So that's the first thing. Obviously, unvaccinated, elderly, 65 and over was the second big class of folks that had a higher mortality. Diabetes, hypertension, they're all in the game. COPD, structural lung disease. It was very rare, although we did see some patients who had no comorbidities that were 47 and otherwise healthy that succumbed to this disease. So clearly in Mississippi, which is the unhealthiest state in the country, that's been a big deal. The mortality in healthier states like Denver and Austin, Texas, have been a little bit lower, but their patients look a little different than ours.
You know, I hesitate to use the phrase silver lining, but when we consider the fact that Omicron is so contagious but not as virulent, is it in any way possible to see a positive in that there is more natural immunity out there now, in your opinion?
I think we'll see more natural immunity as more people are testing positive, and they're going to mount some antibody response. I think the data is not clear to see whether the antibody response or your immunity response to Omicron is going to be quite as vigorous as it was with Delta. I think we'll see that. I will say that, again, and I know that I'm preaching to the choir here, is there's still a role for vaccination and there's still a role for appropriate boosting, even if you've had Omicron or Delta in the last couple of months. So I ask people, they always ask me, when can I get vaccinated? When it's appropriate. So if you have your first shot and your second one and you're 6 months out or more, please go to your primary care doctor and get in there for a booster. I think this is going to be an annual event. People don't balk at an annual flu shot. Hopefully they're not going to balk at an annual COVID vaccine, if that's what it comes down to.
And the time that we have left, therapeutics, let's talk about kind of what's out there. Monoclonal antibodies, very effective against Delta. The jury's out on Omicron. But they are in short supply right now for one reason or another. Pfizer and Merck have an antiviral pill, and some people are wondering if maybe it's a little late considering where we are in this surge. What can you tell us about that situation?
Sure. Our supply chain is not nearly as good as it was with Delta, especially with the monoclonal antibodies. We also know that most of the monoclonals that are out now do not cover Omicron. So if you have a person who is not very sick, hasn't lost taste or smell, doesn't have underlying structural lung disease, and they look like Omicron, we try to use our resources accordingly. The remdesivir, the inpatient medicine we have for COVID, is not very effective against Omicron. We're still using it for hospitalized patients. Paxlovid is a medicine you're probably referring to. It's actually a pill. That's a 2-pill combination. It's by mouth. It's a 5-day course. I've seen some good response to that. If it's taken early, it is active against Omicron. The hard thing about that medicine is it's a lot of drug-drug interactions. And to your point earlier, a lot of our patients take several medicines on top of this medicine with interacts. So you have to be very careful that if you prescribe Paxlovid, that you probably look at what their med list is and make sure that you don't lower their seizure threshold or have an adverse reaction for other meds. But they're out there. We are still infusing the appropriate patients, and I think there's more coming down the pipeline.
Dr. Randy Roth, Same River Health System. Thanks so much, Dr. Roth.
Thank you.